Have you ever felt tired all the time, even after a full night's sleep, or noticed your nails breaking for no reason? Maybe you've brushed off these little things, thinking they're normal or just a part of life. But what if your body is actually trying to tell you something important? These seemingly small signs could be clues pointing to a vitamin deficiency, a condition that's more common than you might think. The scary part? Most people ignore them until they escalate into bigger health problems. But don't worry, you're about to learn how to decode these signals and take charge of your health. In today's video, we'll uncover the 5 most common signs of vitamin deficiencies that are often overlooked. From constant fatigue to unusual changes in your skin or vision, we'll break it all down for you. And by the end of this video, you'll know how to spot these signs early and, most importantly, how to fix them. So, let's dive in. Your health deserves your attention. Constant fatigue and weakness. Have you been feeling drained, like you're running on an empty tank no matter how much rest you get? This could be more than just a busy schedule. It might be your body crying out for help. One of the most common signs of a vitamin deficiency is constant fatigue and weakness. The usual suspects? Vitamin B12 and iron deficiency. These nutrients are vital for producing red blood cells, which carry oxygen to your muscles and tissues. Without enough oxygen, your body struggles to perform even basic tasks, leaving you feeling tired, lightheaded, or even out of breath. Other signs might include brain fog, pale skin, or frequent headaches. For B12, the issue often lies in diet. People who avoid animal-based foods, like meat, eggs, or dairy, are especially at risk. Vegetarians, vegans, and those with absorption issues, like certain gut conditions, are particularly vulnerable. Iron deficiency, on the other hand, can result from low intake of iron-rich foods like spinach, red meat, and lentils, or from factors like heavy menstruation. The good news? These deficiencies are manageable. To boost B12, include fortified cereals, milk, fish, or eggs in your diet, or take a supplement if needed. For iron, prioritize dark leafy greens, beans, and lean meats, and pair them with vitamin C-rich foods like oranges to enhance absorption. If fatigue has become your constant companion, don't ignore it. A simple blood test and some tweaks to your diet might just restore the energy you didn't realize you were missing. Have you noticed your nails breaking easily or your hair thinning without explanation? While these changes might seem purely cosmetic, they can actually be signs of a deeper issue, namely a deficiency in biotin, also known as vitamin B7. This essential nutrient is often overlooked, but it plays a crucial role in maintaining the health of your hair, nails, and skin. When your body doesn't get enough biotin, the results can be noticeable and frustrating. You might experience brittle, splitting nails, thinning hair, or even redness and rashes around your eyes, nose, or mouth. Severe deficiencies can go even further, leading to muscle cramps or strange sensations like tingling in your hands and feet. These are clear signs your body is asking for more support. But what causes a biotin deficiency? Surprisingly, it's not always about poor nutrition. While foods like eggs, nuts, seeds, and sweet potatoes are naturally rich in biotin, certain habits or conditions can interfere with absorption. For instance, eating raw egg whites, popular in some fitness diets, contains a protein called avidin that prevents your body from using biotin. Additionally, pregnancy, smoking, and some medications, such as antibiotics and anti-seizure drugs, can deplete your body's stores of this vital vitamin. Fortunately, biotin deficiencies are relatively easy to fix. Start by incorporating biotin-rich foods into your meals. Almonds, cooked eggs, spinach, and salmon are excellent choices. If you're looking for an extra boost, a biotin supplement may help. But be cautious. Over-supplementing isn't always necessary and can sometimes lead to other imbalances. It's always a good idea to consult with a healthcare professional for guidance. Your nails and hair are more than just parts of your appearance. They're indicators of your internal health. By addressing the root cause of these changes, you'll not only improve their strength and shine but also support your overall well-being. Have you ever noticed painful cracks or sores in the corners of your mouth that just won't seem to heal? This uncomfortable issue might seem like a minor annoyance, but it can actually signal a deficiency in vitamin B2, also known as riboflavin. This vital nutrient is crucial for your body's energy production, tissue repair, and overall cell health. When your body doesn't get enough vitamin B2, your skin and tissues can start to show signs of distress. The most noticeable symptom? Cracked, sore corners of the mouth, often accompanied by chapped lips, an inflamed tongue, or even a burning sensation in your throat. These symptoms might escalate over time, leading to redness and swelling around the mouth or eyes. A prolonged deficiency can also weaken your immune system, leaving you more prone to infections. But what causes this deficiency? For many, it's tied to diet. A reliance on processed foods that lack essential nutrients is a common culprit. Certain medical conditions like lactose intolerance, chronic diarrhea, or malabsorption disorders can also interfere with riboflavin absorption. Even lifestyle factors like excessive alcohol intake, high levels of stress, or poor eating habits can deplete your stores of this essential vitamin. So, how can you fix it? Fortunately, it's simple to address. Start by incorporating riboflavin-rich foods into your daily meals. Dairy products like milk, cheese, and yogurt are excellent sources, along with eggs, lean meats, and fish. For plant-based options, reach for spinach, kale, mushrooms, and fortified cereals. And if you're still struggling to meet your needs, a B-complex supplement can be a reliable backup, but always consult a healthcare professional first. Those persistent cracks in the corners of your mouth aren't just a cosmetic issue. They're a call for better nutrition. By addressing the root cause, you're not only improving your external appearance, but also strengthening your body from the inside out. Do you struggle to see in dim lighting or notice your eyes feeling constantly dry and irritated? These symptoms may seem unrelated, but they can both point to a deficiency in vitamin A, a critical nutrient for maintaining eye health and overall vision. Vitamin A plays a key role in producing the pigments your eyes need to adjust to low light conditions. Without enough of it, you may experience night blindness, a condition where seeing in the dark becomes increasingly difficult. Over time, vitamin A deficiency can also lead to xerophthalmia, a condition that dries out and thickens the protective layers of your eyes. Left untreated, this can increase your risk of infections, corneal damage, and even permanent vision loss. What's behind this deficiency? It often starts with a diet lacking in retinol-rich foods like dairy products, eggs, or fatty fish. For those following plant-based diets, a lack of beta-carotene, found in colorful vegetables like carrots, sweet potatoes, and spinach, can also lead to low vitamin A levels. In some cases, medical conditions like liver disorders or digestive issues may prevent your body from absorbing this vital nutrient properly. The good news? Vitamin A deficiencies are easy to address with the right changes. Start by including more vitamin A-rich foods in your meals. If you eat animal products, options like liver, eggs, and full-fat dairy are excellent sources. For plant-based eaters, focus on carrots, butternut squash, and leafy greens, which are loaded with beta-carotene that your body can convert into vitamin A. Supplements can help if necessary, but always consult your doctor before taking high doses. Excessive vitamin A can lead to toxicity and other health complications. Your eyes are one of your most sensitive organs, and even subtle symptoms like poor night vision or dryness can signal a need for better nutrition. Taking action now to restore your vitamin A levels not only improves how you see, but also protects your eyes from long-term damage. It's a small effort with big rewards for your vision and overall health. Have you ever experienced a strange tingling or numbness in your hands and feet that just doesn't seem to go away? While it's easy to dismiss this as falling asleep or poor circulation, it might actually be your body signaling a vitamin B6 deficiency. Vitamin B6, or pyridoxine, is a powerhouse nutrient that supports many critical processes in your body, including nerve function. It helps produce neurotransmitters, the chemical messengers your nerves rely on to communicate. Without enough B6, your nerves can become irritated or dysfunctional, leading to sensations like tingling, numbness, or even a burning sensation in your extremities. Left unchecked, this deficiency can worsen, causing muscle weakness, mood swings, depression, or an increased sensitivity to pain. What causes low vitamin B6 levels? Poor dietary habits are often to blame. If your meals lack foods like chicken, fish, bananas, or fortified cereals, you might not be getting enough B6. However, lifestyle and medical factors can also play a role. Chronic alcohol consumption, certain medications like anti-epileptics, and medical conditions such as kidney disease or rheumatoid arthritis can all reduce B6 levels or impair your body's ability to use it effectively. Fortunately, correcting this deficiency is straightforward. Start by adding vitamin B6-rich foods to your diet. Poultry, salmon, tuna, and turkey are excellent animal-based sources, while vegetarians or vegans can turn to chickpeas, potatoes, spinach, and fortified plant-based options. If dietary changes aren't enough, consider a vitamin B complex supplement. But remember, more isn't always better. Consult a healthcare provider to ensure the right dosage for your needs. Tingling and numbness might seem minor, but they're your body's way of signaling a deeper issue. Addressing a vitamin B6 deficiency doesn't just relieve discomfort, it supports your overall nervous system health and helps you stay sharp and energetic in the long run. Your body is constantly sending you signals, and and recognizing the signs of vitamin deficiencies can be the first step toward better health. From persistent fatigue to brittle nails, cracks in the corners of your mouth, poor night vision, and tingling in your hands and feet. These are not just random occurrences. They're your body's way of asking for help. The good news is that most vitamin deficiencies can be addressed with simple dietary changes or supplements. Whether it's incorporating more iron-rich foods, adding beta-carotene-packed veggies to your plate, or consulting a healthcare professional for guidance, small adjustments can lead to big improvements in how you feel and function. So, take a moment to listen to your body and act on the signals it's giving you. Start with one change today, and you'll be amazed at how much better you can feel. If you found this video helpful, give it a thumbs up and share it with someone who might benefit. Don't forget to hit that subscribe button and turn on notifications for more tips and insights on living your healthiest life. Thanks for watching, and take care of yourself.